Ain't no half stepping with Marcus J. That was a very interesting clip that we played there, and I didn't expect to really take any additional comments on it, but because of how spirited we got in the first hour, if anybody wanted to comment on it, then we would. If not, then we'll move on. Any comments, anybody? Yes, no, maybe so. All right. Ain't no half stepping with Marcus J. All right. At this time, every single week, we always profile a missing and or exploited child. Of course, tonight is no different. Today, right here in the Chesterfield County area of Richmond, Virginia, we are looking for Uric Alexi Jones of the 3900 block of Keswick Place. He was last seen today at about 2:30 after being dropped off at his school bus stop. They're looking for a 12-year-old Uric Alexi Jones. 12-year-old Uric Alexi Jones of the 3900 block of Keswick Place is autistic. He is described as a black male standing 4'9", weighing about 90 pounds. He has short black hair and brown eyes. He was last seen wearing khaki pants, a blue, green, and yellow striped shirt with long sleeves. Anyone with information about Jones's whereabouts should contact the Chesterfield County Police Department at 804-748-1251 or Crime Stoppers at 804-748-0660. Putting that out specifically to our folks here in the Richmond, Virginia area. Outside of the area, as always, contact 1-800-THE-LOST, 1-800-843-5678, or hit them on the website missingkids.com. Scary. It's the second autistic child that has gone missing here in the Richmond area in as many days. There was another one over the weekend that went missing, and thankfully he was found without incident. And we're looking for the same result here with Uric Alexi Jones. So keep your eyes open. There's a photograph here. I'll make sure he's on everybody's Facebook pages here, as well as the Ain't No Half Steppin' with Marcus J fan page, as well as the Legacy Internet Radio page on Facebook. Keep your eyes open, folks. We need to get these kids home. Ain't No Half Steppin' with Marcus J, ready to get healthy with my sister, S.Y. Butler. What you got, sis?
Oh, my gosh, I'm about to get on your nerve.
So what else is new? That was too easy, man. I'm sorry. You're not going to talk without a mic, though.
You know what? Don't let him bully you. If you feel like getting up, then you get up. I am tired of you trying to be a bully. And watch your mouth when you speak to me, youngin.
Youngin?
Yes.
Girl,
watch it.
We cut these mics off. We can.
You don't have to cut them off. I want to hear you. Let them hear you get your butt.
What you gonna do? What you gonna do?
Last time somebody said that to me.
Oh man.
You don't want to go there. Yeah, you look better that way.
I just made a mean face at her, y'all, and I won the argument by default. You got, sis?
Whatever.
You lucky I like you.
I am going. You know what I'm looking to do?
What you got?
I'm looking to pull a lot of things that maybe we know somebody who suffers with it, or something that we may be suffering with ourselves. Something that's starting to get popular. No, not constipation. I should do something on that too, because.
I'm sorry.
Oh wait, so I'm not alone. So we're gonna do IBS next, but
Michelle is
yes.
checking in. Michelle K. Everybody
hey,
say
Michelle.
peace to Michelle. She's saying hey to everybody.
Hey Michelle.
Hi Michelle.
That's your girl. So what you got?
So I'm gonna talk tonight about the sciatica. All right, I know a few people with it. And I may be slightly concerned that my problem may be due to this. So, I don't know. But after reading it, maybe I'm becoming a hypochondriac. I don't know. But let's see. All right, that's enough.
That happens. I do that. Don't ever go on WebMD because you have everything.
I know, because you'll have everything in
Mm-hmm.
there. Like, oh my God, I got that. But sciatica is a pain in your lower extremities, resulting from irritation to the sciatic nerve. The pain of the sciatica is felt from your lower back, which is your lumbar area. So if you put your hand down low, right where that little dimple dips right between the split, there we go. Marcus is enjoying his. He's dancing with it.
I'm twerking.
Oh, is that your twerk? He's moving like Miley.
Let's get that on camera. Let's get that on camera.
I think I got a little more ass than Miley. I mean, God,
Yeah, you got a little more than her.
just a little.
Now, again, the nerve is placed in the lower back, lumbar area. Right, the pain comes straight through there, and it radiates straight down your knee at times. It can also radiate around your hip and thigh area, straight down the leg. Now, what causes it? It says the most commonly known problem or troublemaker for the sciatic is a herniated disc. And that's where I get nervous. So it says if pressing on that nerve can cause an irritation or inflammation of the sciatic nerve, and that can produce the symptoms same as sciatica coming straight down. So anything that presses on that lower back area can hit that nerve. What are the symptoms? It says sciatica causes pain and a burning sensation, a numbness or a tingling radiating from your lower back and your upper buttocks, down your back, down to the back of your thigh and the back of your leg. And that is a result coming straight from the lumbar. It says hip pain, leg pain, and your butt. They all hurt.
So you got pain in the ass.
Yeah, pain. Well, not actually a pain in the a pain above.
I just wanted to say pain in the ass.
Yeah, you know what? I want you to step outside.
I'm sorry.
Flag down the train.
I behave.
Yeah.
No, I won't.
Okay. So it says, while the sciatica is often associated with lower back pain, it can be present without lower back pain. Severe sciatica can make a walking difference almost impossible. So if it's that bad, you won't even be able to walk. And I guess it's from the pressure. Once you step down, it shoots straight up, making walking impossible. Sometimes the symptoms of the sciatica are aggravated by walking or bending at the waist and relieved by laying down. It says the pain relief by changing position can also alleviate the pain depending on how you lay, from partial relief to complete relief. Risk factors. What are the risk factors for sciatica? Risk factors include degenerative arthritis of the lumbar spine, lumbar disc disease, and trauma or injury to the lumbar spine. Okay. How is sciatica diagnosed? It's diagnosed with a physical examination and a complete medical history. It says you can also be diagnosed by an examination and maneuvers of the lower back by the doctor to pinpoint where the pain is. Sometimes they say x-rays and other tests such as CAT scans, MRIs, electrocardiograms are also used to find an exact cause in severe cases. So another reason I get concerned is sometimes like my back will kind of hurt really bad, and I can feel it numb straight down my leg if I bend to pick something up, if I reach for something, and then it's like, oh!
Your body lock up?
I'm frozen.
Because of the pain?
I'm good. Yep. I'm frozen, just like that.
Let me ask you a question.
Mm-hmm.
Is this a condition that is more prevalent in males versus females,
Nope.
versus males, or does it matter?
Nope, it doesn't matter.
Okay.
It has no preference in gender or race or anything.
It is very common in pregnant women. That is when
Mm-hmm.
I experienced it the
Mm-hmm.
worst. Just
Yep.
excruciating pain out of nowhere.
Mm-hmm. Now, as far as treatment, bed rest, actually, they said when pain is not so severe, they require bed rest for 2 weeks to 4 weeks. Complete bed rest, no getting up. I mean, other than to go relieve yourself, there should be no reason that you should be getting out of bed. Other treatment options are addressing the underlying cause, which is where the electrocardiograms and the x-rays come into play. Physical therapy, medication, and sometimes cortisone injections. A variety of low back conditions and stretching exercises are also advised to help recover from the pain. There's sometimes, if it's really severe, surgical procedures that'll be mandated to help you feel some relief. And then they say you don't feel complete relief, but your pain is nowhere near as bad as it was before, just in order to kind of cushion that space.
Once you get the surgery, does it say you have to continue getting the surgery?
No.
Okay, it's a one-time deal.
It's a one-time deal for the surgery.
Depending on the cost.
Well, it really won't matter. When they go in and do surgery, it's to either put something in between the cartilage to kind of block the nerve from being hit by anything, or maybe pins, or maybe the bone is not straight and that's what's causing it, so they'll try to straighten up the bone. But it wouldn't matter too much. Once you get it, if you're still experiencing some pain, they do say that you can get injections again for it, which should help relieve whatever pain you do have left.
I'm just saying because I had a fusion in my neck.
You did?
Yeah.
I had in your neck?
Yeah.
Oh.
Yeah.
No.
Exactly.
So, what is the outlook for a patient with sciatica? Depending on the precise cause of the sciatica and the duration of the symptoms, the outlook for recovery from sciatica ranges from excellent to having long-term chronic symptoms. And then they ask, can it be prevented? Sciatica can be prevented to some extent by avoiding low back trauma as best you can. So that's paying attention to how you lift things. Always want to bend your knees. Paying attention to how you exercise. You want to pay attention to where you're putting that extra weight and helping you do whatever the exercise is that you're doing. You know, some things you can't help, like vehicle accidents. You know, you can't help those, or, you know, just a freak accident, something hits you and it hits you the wrong angle can cause a problem. So in any event, the only thing that you can pretty much do is just be as careful as you can. Mind your health, be careful how, you know, like I said, how you're bending, how you're moving, how you're twisting your body when you're exercising, where you're putting all that weight. Other than that, there's really nothing that you can do to prevent it. And that is my healthy segment for the week.
Ain't no half stepping with Marcus J. I love the healthy stuff, y'all. I really do, because you just learn so much, and the stuff that we talk about are things that you just wouldn't think about. I mean, you know what I mean? Like, you know, people that deal with it, but they may not be telling you that they got something going on, like sciatica. You just might realize that your friend might be going through.
My mom suffers from sciatica.
Sciatica. Sciatica. Okay, I'm sorry.
Yeah.
Sciatica.
The K left.
Yeah, sciatica. You know, I had a nice little smooth little transition set up, and y'all just
I left it alone.
Yeah.
I left it alone.
But no, I like that. No, I like that. You know, throw me off my game a little bit. I appreciate that. But seriously, like when we talked about that, we talked about shingles, and we talked about MS and HPV. I always get the acronym all jacked up. But we talk about a lot of stuff, and every time that's why brings it, she brings it. Ain't no half stepping with Marcus J. We are going to take another break. When we come back after a word from our sponsor, we're going to have a word from my man Stephen A. Smith, who will join us on Ain't No Half Stepping with Marcus J. for the very first time. No, not live, y'all. I don't know the dude. I got a clip from when he was talking about something.
Why you saying?
Because, you know, I know the phone's going to blow up like, oh, you got Stephen. No, I don't have Stephen A. But you do want to hear his commentary on this one.
Did you say Stephen A?
Stephen A. You want to hear his commentary on what he's going to be talking about, because it is something that is kind of affects pretty much everybody in our general age group, and I'll just leave it at that. Marcus J. Ain't No Half Stepping with the crew and you on social media. Be back in a minute.